video we'll be reviewing drugs used in the treatment of bipolar disorder. Bipolar disorder occurs in 1% of the population. It is not a common disease, however, it can be a very devastating disease to the patient and their family. Onset usually occurs by the third decade of life, so a patient in their 30s. There are high suicide rates. 20 to 25% of these patients attempt suicide. Family history is common and tends to be more severe as generations of a family progress. Treatment is critical and can be very complex. There are two common types of this disorder. It would be unipolar is marked by depression. Bipolar is marked by depression and mania or excitation, which is alternating periods of both the depression and the mania. Psychotherapeutic agent classes used to treat the disease are anti-manic, and the drug used in that category is lithium carbonate, and then anticonvulsant mood stabilizers, which would be carbamazepine, valproate, and gabapentin. Gabapentin is ranked number 33 out of the top 200 prescribed drugs. Lithium, carbamazepine, and valproate were not ranked in the top 200 drugs. Since these drugs are generic, they are manufactured by many different companies here listed. The two drugs that I'm going to be focusing on are carbamazepine and lithium. Carbamazepine is an anticonvulsant. It's used as a mood stabilizer. Pregnancy category is D, so it is contraindicated in pregnant patients. It is absorbed in the GI tract, metabolized in the liver, and excreted in urine. The dosage is initially 200 milligrams twice a day by mouth, and the dosage can increase 200 milligrams a day at weekly intervals, and the range is typically 400 to 1200 milligrams a day, depending on the person. Lithium carbonate is an anti-manic inorganic salt. It has antidepressive effects. It is also pregnancy category D. It is absorbed in the GI tract very rapidly. Peak levels in 3 hours and complete absorption in 8 hours. It is not metabolized, but rather excreted unchanged by the kidneys and in sweat. This can pose a problem in a patient who sweats excessively or exercises because the excretion of the sodium causes lithium levels to elevate. The dosage is 300 milligram tabs 3 to 4 times a day, and the max is 2.4 grams a day. There is a very narrow therapeutic range with lithium. Lithium carbonate is a psychotherapeutic agent affecting the storage, release, and reuptake of neurotransmitters. It is handled by the body very much like sodium. It has been the drug of first choice or the gold standard for treatment of bipolar manic depressive order. The efficacy of the drug is directly related to blood plasma levels. Levels in the brain are much lower, so not a lot of drug crosses the blood-brain barrier. It's common for the patient to have frequent blood draws to evaluate the blood plasma level because there is such a narrow therapeutic range. 0.6 liters is ineffective, while 2.0 liters is toxic to a patient. And again, that is found out by doing frequent blood draws to check the levels. Drug interactions with lithium: NSAIDs, aspirin, indomethacin, halperidol, and metronidazole, and carbamazepine all decrease lithium clearance in the body, leading to increased levels of the drug or toxicity. Any CNS depressants will cause drowsiness in the patient, and salt intake will alter drug levels. Toxicity risk with lithium is anything affecting kidney function will affect lithium levels due to a sodium imbalance. And a side effect of this drug is reduced kidney function, so this can get pretty complicated. Vomiting and diarrhea will cause dehydration, which will equal a salt imbalance affecting sodium levels. Diuretics also give a salt imbalance affecting sodium levels. Low sodium intake or high sodium excretion will affect lithium blood levels. And with an increase in lithium levels and a decrease in sodium levels, the balance and compliance is difficult for patients, but it is critical to the therapeutic success of the medication. Toxicity symptoms are characterized by seizures, circulatory failure, excretion of only small amounts of urine, coma, and death. So this can be really serious and really difficult for patients and probably sometimes their doctors to manage. Some of the side effects of lithium: tremors, cognitive and memory impairment, nausea, weight gain, increased urination due to the excretion, hypothyroidism, possibly with a goiter, and it is a teratogen, so it's not advised during pregnancy. Dental concerns: you'll want to assess salivary flow as a factor for caries, periodontal disease, and candidiasis. Check for xerostomia management. How is the patient taking care of their dry mouth, or do they need further instructions? Prevent orthostatic hypotension by allowing patient to sit up slowly and remain seated for at least 2 minutes after the procedure. Encourage effective oral hygiene to prevent soft tissue inflammation. The disease may make it difficult for patients to follow an oral care program. Refrain from the use of sodium-containing dental products, because again, that can alter the blood plasma levels. Epinephrine is not a contraindication with antipsychotic meds, but other sedatives may be contraindicated during dental treatment due to increase in toxicity or drowsiness and things like that. Some dental hygiene considerations: be aware of your verbal and nonverbal interactions with these patients. They might take something you say maybe the wrong way or something like that. Try to use a non-threatening manner. Try to increase motivation of patients for good oral hygiene. Some patients are reluctant or embarrassed to say that they have a mental illness, so ensure your patient that all information is confidential. Be understanding and empathetic to your patient. Check vitals at each visit. Determine which medications the patient is taking and be aware of the side effects and oral effects of those medications in the oral cavity. Some highlights is that unipolar is, remember, just depression. Bipolar is the alternating periods of depression and mania. It's not a common disease, but it can be devastating. Treatment is very critical, complex, and can be very difficult for the patient. Drugs used to treat the bipolar disorder are usually anticonvulsant medications because of mood-stabilizing properties. And these meds are, again, carbamazepine, gabapentin, and valproate. Lithium carbonate is an anti-manic drug commonly used. Lithium has a narrow therapeutic range, so it has a high risk of toxicity. Sodium intake and excretion factors are very important for patients taking lithium. And then be an empathetic hygienist to these patients. Their life is probably not the easiest, and so if we could be encouraging and caring to help them along, I think that would be helpful.